Joins us from Johannesburg. Very good morning to you, Helen. Tell us what we can expect today.
Well, we're obviously not going to be rolling it out today, but I think what's exciting is that it's arriving in the country, that we have vaccine finally arriving in the country. I mean, every country in the world, as you know, is really pushing hard to get vaccine access. And there are some fantastic initiatives like COVAX and the African Union trying to get vaccines for our region. But there's a shortage of vaccines. So being able to secure 1.5 million of the AstraZeneca, initially a small amount of Pfizer, possibly more. We heard over the weekend of Pfizer, J&J. I mean, this really starts to get the ball rolling.
And is anyone better, or is it just great to get any vaccine at all, whichever one you land up with?
Well, you know, if you look at the way that the different vaccines have performed in clinical trials, some certainly have a higher efficacy. They seem to be more effective than others. We also know that some of them are being much more affected by the variant that we have in this country, so their effectiveness is reduced. But having said that, we will only approve and roll out vaccines that have significant effectiveness. The AstraZeneca vaccine had about a 70% effectiveness, and we haven't yet got all the results about how the variant will impact. It will impact just as it is on other vaccines, but this is still a highly efficacious vaccine. And at the moment, when we get vaccines, whether it's 70% or 90% or even just bordering just above 50%, we should seriously consider rolling these vaccines out, because it's going to be many, many months before we have global access freely to vaccines.
And how do you determine how strong the vaccine is when you talk about the 50 or the 70%? And if it's not effective, where does that leave you?
Well, it is effective. I mean, no vaccine is 100% effective. That's even the best vaccines in the world. Nothing is 100% effective. That's the first thing to say. So the top of the league is at the moment the Pfizer and Moderna, which came in at about 95%. But even their effectiveness looks like it's going to be somewhat reduced by the variant that South Africa has at the moment. So the way that we estimate how effective a vaccine is in the clinical trials. And in the clinical trials, we look for, most of the clinical trials, in fact, all of them at the moment, look for laboratory-confirmed disease. And many of the vaccines that we're looking at, including AstraZeneca, have been shown to reduce serious disease and moderate disease. And that's very encouraging. That means that it will protect people. It won't protect everybody. And what we also don't know for any of the vaccines is whether it will protect us against asymptomatic or very mild infection. The reason that's important is that we don't know whether the vaccines will stop transmission of the virus, because even if we're protected against serious disease, if we can still get it very, very low key, will we still be shedding virus, and will this virus continue to spread? Many, many questions still to be asked, but I think we're very excited to have the AstraZeneca vaccine today.
Oh yes, we are excited. So while we wait, the rest of us, I mean, what is it that we should be looking out for? Should, you know, if you've had COVID, should you definitely get the vaccine when you have the opportunity to do that? I mean, basically, should everyone get the vaccine, regardless of your status?
Eventually. I mean, you know, it's going to be in a phased approach, because clearly what we want to do is to find our most vulnerable frontline workers first. And we're starting with the healthcare workers, you know, people who are in ICUs, people who are face-to-face and with COVID patients and so on. So we're starting there. But as quickly as we can, we want to move to other categories of workers, such as teachers and police officers, people who also have very intense face-to-face exposure. So that is the phased approach. It will have to be phased. There isn't enough vaccine to roll it out very, very quickly to all of us. And
Helen, I've run out of time. Can I just quickly jump in here with a very quick question? It's going to take at least a week, right, before we get this. I mean, is there anything more happening than red tape? Will you be going in there and having a sniff test of their efficiency?
That's quite right. Yes, the lots that are bought in, the regulatory authority tests samples to make sure that in transit nothing has happened. So that will be being done urgently.
Okay, great. Thank you, Helen. Good to talk to you.